why your husband was put in an induced coma because while having surgery, his blood pressure dropped very low. Stay tuned. I've got news for you. My name is Patrick Hutzel from intensivecarehotline.com, and I have another quick tip for families in intensive care. So today I have an email from Veronica who says, "Hi Patrick, why was my husband put in an induced coma? He was having surgery, his blood pressure dropped very low." Well, Veronica, I'm very sorry you are going through this. Because your husband's blood pressure dropped very low during surgery, it can be very dangerous because it reduces the amount of oxygen and nutrients reaching vital organs like the brain, heart, kidneys, liver, lung. So therefore, the doctors may induce a coma in such a situation for a number of reasons. Number one, to protect the brain. Low blood pressure can cause reduced blood flow to the brain, leading to possible brain damage. Also, a medically induced coma can help reduce brain activity and protect the brain function. Also, they would have started him on vasopressors or anadrops, or potentially would have given him blood products like red blood cells, platelets, FFPs, fresh frozen plasma to stabilize his blood pressure. Also, with a low blood pressure, like I said, the brain would have not received enough oxygen, and also he would have stopped breathing potentially with a low blood pressure. Next, reducing the body's stress response. So the body can go into shock when blood pressure drops too low. Inducing a coma can help stabilize the body and allow doctors to address the underlying issue. Also, it allows time for recovery if there was significant strain on the heart or other organs. Keeping the patient in a controlled state or coma can help them recover while doctors treat the cause of the low blood pressure. Next, managing pain and ventilation. If the situation required aggressive interventions like mechanical ventilation, a coma might be used to keep the patient comfortable and stable. Also, what other updates have you had about his condition? I'm sure this is a very difficult time for you. Why did his blood pressure drop? Most likely because he was bleeding during surgery, right? That is one of the most common reasons why the blood pressure is dropping during surgery, or could also be a side effect from him being anesthetized for surgery. Maybe he reacted to some of the medications, and that dropped his blood pressure, right? So maybe his heart rate dropped, maybe his blood pressure dropped because his heart, I've seen that too. He might have had a heart attack, God forbid. But you got to look at all options here. Or he might have had an allergic reaction to medications, or he might have been developing an infection or even a sepsis if there was an undetected infection before surgery. And also fluid loss and dehydration. If the body is dehydrated or not receiving enough IV fluids, blood pressure can drop quickly as well. And like I said, reaction to medications, and also pulmonary embolism or other clotting issues cause a drop in blood pressure, and nerve reflexes like a vasovagal response especially can cause the heart rate and blood pressure to drop. So that hopefully explains this question to you in much detail. Now, I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years, and I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very confidently say that we have saved many lives for our clients in intensive care. And you can verify that on our testimonial section at intensivecarehotline.com. And you can verify it on our intensivecarehotline.com podcast section, where we have done client interviews who verify on our podcast how we help their loved ones, how we help them to save their loved ones' lives in intensive care. And I know that my advice in our life is literally life-changing, because we have saved so many lives and we have improved so many lives. So it's literally life-changing. You can join hundreds and hundreds of members and clients that we helped over the years to improve your life instantly by making informed decisions, having peace of mind, control, power, and influence when you have a loved one critically ill in intensive care. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you, and I talk to you and your families directly, I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And I also talk to doctors and nurses directly on your behalf so that they are held accountable. And I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. And we also do medical record reviews in real time. I also represent you in family meetings with intensive care teams. We also do medical record reviews after intensive care so that you can get all your questions answered if you need closure or if you're suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecarehotline.com. If you click on the membership link, or if you go to intensivecaresupport.org directly in the membership, you have access to me and my team 24 hours a day in the membership area and via email. And we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to make informed decisions, have peace of mind, control, power, and influence. And if you like my videos, and all of that you get at intensivecarehotline.com, call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on the show, and you will get notification for the YouTube live if you're a subscriber to my intensivecarehotline.com email newsletter, or if you're a subscriber to my YouTube channel. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care.